Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel today we're going to be talking about a very important topic, that is anterior open bite. Let's start. So I think it was important for me to talk about this topic, which is known as anterior open bite, and this basically means, now let me tell you about what overbite means. So your teeth are supposed to, your upper and lower teeth are supposed to meet in a certain fashion. That means there is supposed to be a vertical overlap between the upper incisors and the lower incisors. Usually the lower incisors have to be inside the upper incisors, and this vertical overlap is known as an overbite, which is usually 2 to 3 mm. However, in some cases this vertical overlap does not happen, and that is known as an anterior open bite. Now, as per the literature, if this anterior open bite is more than 4 mm or 4 mm or more, then it becomes a treatment need, that it needs to be treated. Now, broadly it can be classified into a skeletal anterior open bite or a dental anterior open bite, depending upon the etiology, and it has other multifactorial causes such as neuromuscular causes, genetic causes, and it also has some muscular causes or some sort of aberrations that could be leading to myofascial problems, muscular problems, differences in the way the growth patterns of the face and the musculature of the whole craniofacial complex happens. So there's a lot of causes ascribable to why this happens, but on a broad classification it is classified into a dental open bite or a skeletal open bite. So it also depends upon at what age this is actually happening. So that's where the treatment modality becomes different, and you need to understand that the main problem that this causes is on the basis of aesthetic grounds, on the basis of speech and mastication. That means when you're trying to eat, the food is not getting bitten upon by the teeth. Secondly, you might have lisps like problems of speech, and definitely it can lead to a lack of confidence in your social circle, because of the fact that there is a definite open bite scene where your curve of speech, which is supposed to be in a different manner, is exactly reversed, and you see that there's a window and there's an anterior open bite, which might cause you to have confidence issues. Now, coming to the most important causes and the common causes, which is usually seen in growing children, usually right up to the age of 6 and beyond, that is around 7.5 to 9 years of age, which is due to digit sucking or thumb sucking, which persists long after it should have been avoided or stopped. That is 6 years of age, and if the kid is actually sucking on the digit or thumb for more than 6 hours per day, there's a high likely chance that this might develop into an anterior open bite, because of the fact that the incisal eruption of teeth is not happening, and what is happening is there's a negative pressure that is created. It creates a different disbalance in the neuromusculature and the complex of the face and the vault of the palate and so many other things, so that it leads to an anterior open bite. Now, what is the way to deal with it? The main thing is you have to first identify what is the age of the patient, and you have to try and make sure that the patient's habit is stopped, it's deterred. You can either do that by putting something on the thumb and using deterrent appliances such as high-rec appliances, or you can also do one more thing, you can do positive reinforcement, because you have to make sure that this habit needs to be stopped. Now, usually in smaller children, this habit, if stopped, the resolution happens spontaneously. However, in older children, let's say pre-teens, where this habit has been stopped but the teeth have come in, the permanent teeth have come in, this might require some different measures of treatment modality. Because the child is growing, you will definitely have to see an orthodontist, and you'll have to you can make use of the growth potential of the child, and you can use something known as myofunctional therapy. In myofunctional therapy, you can use a lot of things such as high pull headgear, vertical chin cup. You can also use stuff like orthodontic appliances such as twin blocks, posterior twin blocks. You can definitely use other appliances such as Frankel 4 regulator, bionator appliances. Now, these things are very complex in there for a layman to understand, but the orthodontist who is seeing the case in question would definitely understand what it means. Also, if the growth potential of the child's body is ceasing, you might have to go for more permanent solutions such as orthodontic therapy, that is fixed mechanotherapy of braces, where you might require intermaxillary elastics. You might even require, temporary anchorage devices such as mini plates and screws and dental implants as well. You have to understand that in adults where the growth potential has ceased, you have to go for a combination of orthodontic therapy and orthognathic surgery, especially in severe skeletal anterior open bites, where you can use bi-jaw surgeries, you can use maxillary impactions, you can use one jaw surgery, and so many other things. You can do the rotation of the mandible. Now, these are very specific things which are out of the purview of the layman to understand. But you have to understand, once the growth potential of the child stops, you'll have to go for more definitive measures like braces and orthognathic surgery, or just braces if it's just dental etiology of the malocclusion, that is the anterior open bite. All in all, if you're a person who is having a family member, a child, a preteen, adolescent, or even an adult who is going through this harrowing experience of having an anterior open bite which is causing problems in speech or just confidence issues in the social circle, you might as well visit a braces specialist and orthodontist who has specialization with how this works, and get all the scans done, all the x-rays and the tests done, so that you can make sure that the right treatment plan is chalked out and go ahead with it, so that you can have the treatment done. And one last thing I'll talk about is the relapse. Yes, anterior open bite is one of the most difficult things to correct in malocclusions when it comes to orthodontics. I'm a periodontist, but I'm telling you this as per the literature. It's already been recorded that anterior open bites have the highest relapse rates, especially around orthodontic relapse, because of the fact that the orthodontic force and magnitude has been very high because of the fact that the anterior open bite needs to be closed. And on top of that, there are a lot of factors when it comes to orthognathic surgery, relapses for various surgical reasons, various anatomical reasons, various healing reasons, that is definitely out of the purview of this. But all I can say is that if you are going through, or someone in your family is going through this anterior open bite thing, it's the best thing to do is visit a dental office and visit a braces specialist to get yourself treated. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly, as I might be busy with patients. Just drop me a message on WhatsApp, and please wait for a few days, because I might not reply on the same day or even 2 or 3 days later, because I get a lot of messages and I'm very grateful for that. But you have to understand that it might take me some time to respond to the messages, and please be patient while you're addressing me. That's very important. And if you have any queries, doubts, apprehensions, or insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.